sure we're good to go. Thank you so much. Also, good morning, good afternoon, good evening, wherever you are in the world. We have folks from everywhere dialing into with us today. My name is Claire Byrne. My pronouns are she, her, and I'm the Senior Community Manager for RSA US. And some of you I met before, some of you I haven't. So delighted to have you here with us today. On behalf of myself and the RSA US team, my colleague Tony here with me today, and our wonderful speakers, I'd really like to thank you for joining us for this month's US Salon on exploring women's health and AI. So before we get started, there's a couple of little things to go over, like a bit of background about who we are, what we do, and some ground rules about today's event. So if you're not familiar with the RSA, we have been founded in the UK, and we are the Royal Society for Arts, Manufactures and Commerce, and have been uniting people and ideas to resolve the challenges of our time since 1754. So we have some history. We've been around a while. Today, the Society exists as an international fellowship-driven social change organization. We're committed to a world that is resilient, rebalanced, and regenerative, where everyone can fulfill their potential. Our proven change process, rigorous research, innovative ideas platform, and unique global network of 31,000 changemakers work collectively to enable people, places, and the planet to flourish. And of the 31,000 fellows spread out around the globe, approximately 1,200 or so live and work here in the US, including Afifa Waheed, who's here with us today, and Lesley-Anne Long. And RSA US exists to coordinate fellowship activities in the United States with an aim towards moving the needle on addressing the inequities of our society. And one of those topics for today is women's health and AI. So before we jump into the chat and introduce speakers and really get into it, I just wanted to touch on some of our kind of rules of engagement or ground rules about today's event. And this is how we aspire to show up in our virtual spaces together. So we are always aspiring to show up in ways that will facilitate inclusive, safe, authentic, collaborative, respectful, and kind spaces, which promote learning and support our purpose. So to solidify this, listed on the screen, you'll see a couple of different things, basically, essentially values of how we want to show up and how we're committed to showing up at our events. So take a moment to scan them, ensure you're in agreement with caring for ourselves and one another in these ways. And any questions or anything that's missing on that slide, feel free to message myself or Tony. And you can just find our handles under our names. You can send us a private DM. That's no problem. So before I introduce our speakers, I'm curious to know where y'all are at in terms of AI and various tools that you might use. So while I'm chatting and introducing Lesley-Anne and Afifa, I would love to know a little bit about your level of interaction with AI tools. So it's a bit of a big question, but we'll get into it. So what specific digital health or AI tools do you use? Or maybe more specifically for some of you, how do you see yourself using AI tools? And what does that look like for you? So you can pop your answers in the chat. I know Tony has just asked you all there. So I'll introduce our speakers while you're noodling over that one. Afifa Waheed FRSA is a New York-based lawyer and scholar specializing in global healthcare law and policy. She trained as a barrister of England and Wales, worked at the United Nations, assisted with COVID-19 immunity litigation, and represented clients in healthcare and malpractice matters in New York. She has worked with governments, led initiatives, and contributed to projects across the globe. Afifa is also the co-founder of an NGO focused on raising awareness of healthcare issues and access to care, especially for women, children, and students. As a dedicated advocate for equitable access to healthcare, she is currently working on a tech-driven startup focused on healthcare and education. Afifa hopes it will transform how students, parents, and educators approach mental and physical health with a strong emphasis on prevention and well-being. She is seeking partners and supporters who share her vision and can help turn her startup project into a reality. So feel free to reach out to Afifa. I know Tony is putting some links in the chat so you can connect if there's any interest in having a chat. Also, Lesley-Anne Long, FRSA, welcome Lesley-Anne, is an experienced leader at president and CEO level with reach across Africa, the US, and Europe, a former barrister and dean of Faculty of Health and Social Care. She has extensive experience cultivating public-private partnerships and facilitating high-level connections across the field of global health, digital technology, international development, higher education, democracy, and governance. Clients have included government, regional organizations, tech companies, and other businesses, World Health Organization, the World Bank, NGOs, and academic institutions. Currently based in Washington, D.C., Lesley-Anne is co-founder and chief strategist of Wonderfuture, an organization working in the fields of global digital health, climate, and democracy. She's a board member and advisor for several organizations, including Health AI and Wilton Park, as well as a fellow of the RSA and member of the World in 2050 Brain Trust. So we have some pretty great speakers with us today, lots of experience, lots to contribute. And I'm sure there'll be huge amounts of questions. So we'll kick it off firstly to just get a little bit of sense of our speakers, their journey with AI and women's health. So I'm going to start with yourself, Afifa, if that's okay with you, not to put you on the spot. So what has been your journey with AI and women's health, whether it be through your work, your community, or your personal life? Could you just tell us a little bit more about that?
Thank you, Claire and Tony, for hosting such an important event and bringing us all together. Very pleased to be here today. So I have had extensive experience in global health and law and policy. From a young age, I have been interested in healthcare, life sciences, human rights, having trained as a barrister and as a lawyer, and having worked on the scholarly front. Women's health has always been a key area of focus, particularly having worked for a family NGO as well. My family and I have long been dedicated advocates for health equity, particularly for women and children, emphasizing prevention, as Claire said. The unfortunate reality is that whether it's access to drugs, medical care, post-pandemic healthcare, or life sciences, it's always women who have the most to lose and bear the burden. So our goal has always been to improve care for the vulnerable. Women throughout the world face various challenges, regardless of their background, race, heritage, or religion. In recent years, with respect to AI, I have explored how AI could support women's health and spoken with patients, professionals about its tremendous potential if built responsibly. I am currently writing a paper on AI's ethical and legal implications in healthcare, exploring how existing regulations already offer some sort of protections. As for my direct encounters with AI, whether for research or medical visits, just to ensure before we dive into that, today we're talking about generative AI, not machine learning. The latter has been around for decades. So now the generative AI is making into our lives, it's getting more spotlight and attention. So my direct encounter with generative AI, I have not yet seen it in healthcare, but I do know that practices are now including it and also asking for consent. For example, plenty of practices I have spoken with or physicians, they're now using AI Scribe. It's a tool, and I think it's a wonderful, intuitive tool. But as always, AI is as good as the data we feed them and as objective as the humans who develop them. I have personally used AI in my research, plenty of practical and meaningful ways to use them. For example, AI can quickly summarize documents, quickly translate your notes into text. And finally, as Claire said, I am working on a tech-driven educational startup, which will incorporate some use of AI. From the beginning, I have been quite focused on building it responsibly, especially by addressing algorithm biases early, even before developing the prototype. Our goal is to improve healthcare our goal is to improve healthcare outcomes for students, particularly female students. And even if AI was not in the picture, before anyone forms anything, we have to be in the shoes of our patients, the clients that we are hoping to serve, the customers that we will be helping along the way. This approach, not only does it help with engaging with collaborators and stakeholders from the start to ensure that our solution is grounded in real-world needs and equity, but we'll also be practicing compassion and kindness. So for me, I think that's the most ethical way to approach a startup addressing healthcare, and definitely one in the one with AI incorporation.
Amazing. Thank you so much. Lesley-Anne, over to you. It would be great to know a little bit more about your level of your journey with AI and women's health through your work, your community, or your personal life. So over to you.
Claire and Tony, and also I'm really glad to have the opportunity to meet Afifa, because everything she's just talked about is so vital when you're creating the tools, that whether using digital or AI technology. So we were just talking before this webinar started about connecting afterwards to see how we might be able to, through our networks, connect with each other and help her really get her startup off the ground. But just to step back a bit, so I've been working in global health for nearly 20 years. And for over half of that, it's been in digital health. And I've worked in everything from using mobile technologies to train thousands of health workers in Ethiopia, in Uganda, in Nigeria. I've also worked with partners using mobile apps to deliver sexual reproductive health information to young women in Kenya and in South Africa and other countries. And I've also advised governments in Africa and also India on developing digital health systems. So I've seen kind of firsthand, and now that AI is coming into the picture more and more, I've seen how these digital and AI tools really can be transformational. They can expand access, they can enhance quality, and they frankly can save lives. But the magic of that technology really comes with a caveat. And I think sometimes we overestimate the reach, but we underestimate the inequity that can so often be built in, and that Afifa mentioned she's really thinking about very intentionally how to prevent that bias from going into the work she's doing. So I'm generally very excited about the potential of AI, and I'm seeing it in use, but I think we need to be very clear-eyed. I was just going through some recent stats from the GSMA, and still there are 1.8 billion people on the planet who don't have access to digital tools and mobile phones. And mobile ownership is high in many regions, so they have access to these AI apps. But in many low-income countries, fewer than 50% of the population have access to these tools, and the digital gender gaps still persist everywhere. So I think when we're talking about AI and women's health, we need to do this within that broader global context. And for millions of women and girls, AI is not arriving in a vacuum. They have issues around access to clean water, around food insecurity, around conflicts. These really are the daily realities for them. And health systems themselves in many countries are, shaky. And we saw that during COVID. Many are under-resourced and many are overstretched. And yet this is the same reason why we should care about the potential of AI, because it can address these challenges. And if it's deployed and it's done intentionally, then it can really amplify access to health and improve health outcomes in those places where it's most needed. So I think as we in this conversation that we're having, and as you're listening and thinking about what Afifa and I are saying, I really want us to hold in our minds the promise and the reality of healthcare and AI in healthcare. And then just briefly before going back to Afifa, why focus on women's health and AI? Why not just health and AI? And there are 4 reasons that I can share just right now. So we're starting from a deficit. Women's health is typically ignored, underfunded, and undertreated. And there's a very good report, and I'll drop links in the chat, or Claire will share afterwards. There's a report that came out this year that talks about how women's health is systematically underserved. And so AI could potentially offer an opportunity to address that. Second, access remains shockingly low for the reasons that I've just said. And there's a really good Women's Global Health Index that comes out every year from Hologic. And in the report that came out this year, it referred to the fact that only 10% of women were screened for cancer last year. That's 60 million fewer than the year before. And only 10% were tested for STIs. Now, AI can help address those gaps by putting those access to information and testing in the hands of women who, for one reason or another, may not want to go and visit their health worker. Number 3, inequality is entrenched. Afifa talked about addressing the biases, making sure that we're walking in a woman's shoes, understanding what her needs are. Women in high-income countries compared with low-income settings, the gap is huge, and the United Nations has talked about the staggering backsliding in women's health in these low-resource countries. But also, number 4, the cost of inaction of not using AI for women's health is huge. I mean, it's not just a public health issue, it's an economic issue. And looking at a report that came out last year from the World Economic Forum, closing the gap in women's health, including using AI, could add $1 trillion to the global economy by 2040. So there's a huge economic argument there for investing in women's health. And the good news is that investment in AI for women's health is increasing. And last year, there was nearly $11 billion, which is not a huge amount, frankly, but nonetheless, $11 billion being invested in women's health and really looking at how AI can improve personal health and precision health for women. So I think bear that global context in mind, but the importance of focusing on women's health and therefore that investment in AI technologies that really meets their needs. So Claire, I'll hand back to you to ask the first question.
Yeah, no worries at all. And thank you both so much for sharing that and just giving everybody who's here with us today a sense of your background and your work and what you're kind of noodling over in this space, which is really great. You both touched on this a little bit as well, but I would love to dig into it a little bit more of how you see AI currently helping women's healthcare. There's a couple of different opportunities and ways that could manifest, I suppose, that we've seen both in the chat or what you've been working on. So how can we see this space, specifically women's healthcare, benefiting from AI? And I'd love to know, maybe Afifa, if you wouldn't mind going first, or Lesley-Anne, who's drawn to speak first? You are. Okay, that's great. Thank you so much.
Happy to. No worries. Building on what Lesley-Anne has said, she has made some excellent points. Women make up half of the global population, and nearly 80% of the healthcare workforce, and yet they still lack adequate care. Women hold families together, they strengthen economies, they shape education, and when we invest in women, we invest in global progress. And AI has tremendous potential if used and built correctly, not only to accelerate medical innovation, but also to advance health equity if systems are designed with inclusivity at their core. Some of the significant ways AI can help women, and I really want to start with this, is by creating heart disease risk predictor tools. And why is this important? When we talk about women's health, we probably think of reproductive health or gynecology or breast cancer screening. But let me tell you, the #1 cause of death in women worldwide is heart disease. Heart disease is caused by various factors, but the fact that data has always been skewed towards male presentations of diseases has also contributed to the gap. Women have different symptoms that are often overlooked and are eventually dismissed, whether in young or older patients. Even a lack of care in certain areas, like reproductive or mental health, can exacerbate a woman's risk of heart disease. So I really think that AI will help significantly in this regard. Now, in terms of oncological care or breast cancer screening, I'm going to briefly touch on that. Algorithms can help us analyze mammograms with greater speed and accuracy, detecting, for example, subtle patterns or early signs of cancer that might be missed by the human eye, or potentially leading to earlier diagnosis. And it can also reduce false positives or negatives. And then we have gynecological health. AI can come up with, we can build numerous apps with AI enabled. They can offer numerous benefits from preventing infections to tracking menstrual cycles. Then we have conditions like polycystic ovary syndrome. And then we also have, autoimmune conditions that are often underdiagnosed in women, and AI can really help correct the treatment process. Also, if we talk about mental health, many women are often reluctant to seek healthcare, and they take a more reactive approach than a preventive-based approach. They also struggle with transportation, family, work commitments. And I think AI-based telehealth can really assist with that. As well as mental health, if we come up with mental health platforms. But again, I have to say that while AI-based mental health platforms can offer quick solutions, most of us would need to see a human a psychologist for complex issues. Back to you, Claire.
Amazing. Thank you so much. Lesley-Anne, what do you see as being the opportunities, benefits? And I know that you kind of mentioned some of it in your kind of context setting piece of for everybody here, but I'd love to dig a bit more into that.
On what Afifa was saying, I was thinking about this morning. If you imagine a baby girl born today, 15th of May 2025, from her very first breath, or even before her very first breath, AI could be involved in, it's going to be part of her world. So it's going to help a midwife detect complications during the pregnancy and the birth. And it's going to guide the mother through those sort of first critical hours of her daughter's life. So, let's call her Amara. Amara's life begins with that kind of promise, really shaped by data and intelligence and care. And then as she's growing, it can provide, AI can provide advice around her nutritional needs. Let's leave alone the sort of food insecurity that I talked about earlier, but just imagine, AI can provide advice around nutritional needs. And then as her body begins to change, as she gets older, it can provide advice on her menstrual cycle. It can provide chatbots, to Afifa's point, around mental health. So it can, the AI tool or personal assistant can provide someone to, air quotes, talk to in a way that's private and confidential. So, Amara can learn about what's happening to her body, why things are happening, and what she can do to, promote her own health. And then, if she becomes a mother one day, AI is going to be helping her monitor her pregnancy, understand the development of her unborn child, and potentially adapt to her personal physiology, not as a generic woman, but as that particular individual woman. And then, speaking personally, menopause, as you're going into menopause, there are apps that can help you understand your hormone cycles and help you understand what your body's going through and offer actionable support instead of silence or stigma. And then as people get older, as a woman gets older, AI tools, to Afifa's point about heart disease, AI tools can track heart health. They can detect early signs of osteoporosis or cognitive decline and help, Amara to stay more independent and live longer in her own terms. So that's the future that we're seeing happening right now. But of course, there's another side of that story, like the systems are biased. The data can be sold. Amara can have her data sold before she can even say her name. The chatbot that she accesses might not reflect her reality, where she lives and the circumstances in which she lives. There's an issue about surveillance. And I think there's also an issue of AI optimizing for systems and not necessarily for individuals. Will they become skewed to save money for the health insurance companies rather than optimize to ensure the health promotion and disease prevention and management for Amara and other women like her?
Thank you so much. I can imagine there are so many follow-up questions. I kind of don't really know where to start. But maybe if we have time later, we can kind of explore personal experiences that you've had in terms of where you've seen AI help people who identify as women be more informed, more heard, or more empowered on their journey. But I think we can come back to that in a little bit. I'd love to get into equity and invisible data and the ethics behind some of what we have previously chatted about when we've been in conversation before this event, which I know is a concern for all of us. So what are some of the risks that you see around equity in women's health when AI is involved? So are there patterns of invisibility that stand out to you, such as the missing data or the overlooked communities or the unrepresented communities or implicit bias, cultural blind spots, etc.? Could you maybe speak to a little bit of that and how that has shown up in your experience? I'd love to start. Maybe I'll start with yourself this time, Lesley-Anne. I'll put you on the spot, sorry.
That's fine. There's a wonderful book by Caroline Perez, it's somewhere on this bookshelf behind me, called Invisible Women: Data Bias in a World Designed for Men. And I think what Caroline does is capture absolutely brilliantly the way the data is skewed. And that's because primarily it's, youngish white men that are designing the AI tools, that, the data is based on their experience. It's not based on the experience of women, and it's not based on the experience of women in the global south, or women who are, seen as different for one medical reason or another. And so if you have that biased data, Afifa, to your point earlier, the tools are only as good as the data that they're built on. And so, the AI tools are in the hands and minds of the designers, those who build and implement them, and the policymakers who create the regulatory framework. And God knows the AI is developing so fast that there is no way regulation's catching up at the moment. And I'm on the board for Health AI, which is an agency that's actually tackling that issue. It's working with governments around the world on how do you build and implement ethical and responsible AI. Because if you don't do that, you are going to end up not with the wonderful promise of AI and being able to detect early and diagnose early and treat. You're going to end up with misdiagnosis, and you're going to end up with treatments that are not suitable for women's bodies. I mean, just on a very basic non-AI level, I'm 5'4" and I weigh kind of 96 pounds, and the medication I'm given for, whether it's hay fever or something else, is exactly the same as the medication that my husband is given, who is definitely taller and heavier than I am. But we get the same medication because that medication is based on male data. And so we cannot afford to bake all those mistakes into AI. But this isn't something that's going to happen in the future, ladies and gentlemen. It is happening right now. And so how do we have more, young people like Afifa and others who are developing responsible AI that will speak to and reflect women's lived experiences throughout their life course? That was a bit of a rant. Sorry, I'll get off my soapbox now.
Oh, it's fine. Rant away. Safe space to rant. We all get it. Oh, I accidentally spotlit myself. Oh, sorry. I want to pass over to you, Afifa. I know that you touched on this earlier, so it'd be really great to get your insights. Thank you so much. You frozen. Did you freeze? Oh no, there.
Oh no, sorry. I think the spotlight issue just it was distracting me. Sorry. Okay. So Lesley-Anne has already, I couldn't agree more with her, but I'm going to expand on a little, what she said a little. So to address biases, it all starts with thinking from the patient's perspective, as discussed earlier. What would the patient want me to do? How is she struggling? How are they struggling? While regulations can significantly improve the landscape, it's important to understand that static regulations won't help, and Leslie made an excellent point. And regulations can contain too many loopholes, and AI is evolving at a rapid pace. We can't keep up. 5 years down the line, what exactly will we be regulating? We don't quite know. So the best approach for now would be to start within us. It has to start within us, addressing the biases within us. AI in healthcare begins with centering, if we're to discuss in the context of women and healthcare, it starts with centering women and marginalized populations in every phase of development. That means ensuring that diverse perspectives are represented not only in training data sets, but also on development teams, in leadership roles, and within government, governance structures. We must bring representatives of underserved communities to the table: patients, doctors, advocates, ethicists. This way, we'll be improving not only healthcare and medical data sets, but also creating bias-free algorithms. AI models must be subject to regular monitoring for biases and updated as new data becomes available. And because healthcare is a dynamic field, new treatments will emerge, population demographics will change, and patterns of diseases will evolve. So we can't expect to be fully accurate, but we can do our best to minimize the impact. Now, in terms of invisibility, I must mention that When we are, I know there is a question about how can we help women of color better? Now, I don't know if I should be answering that question already, but it's going to come up anyway, so I'm going to briefly touch on that. When we talk about women of color, we are referring to the data set in the West, or people who are generally based in the West. So women's experiences in the West with healthcare and AI will differ vastly from those of the East, Africa, or Latin America. AI tools in the West are being developed to serve those living in the West and in the context of their experiences. So if we were to look at China and India, for example, if they're developing, working on developing their own tools, they will have to address their own sets of biases. The Indian subcontinent itself, for instance, has dozens of ethnicities, a caste system, and hundreds of languages. So they will have to develop it in a way that caters to their society. Now, for example, okay, so piggybacking to women of color, in the context of AI and healthcare, I'm not sure. Some of these terms will be quite misleading and confusing because women of color may include women from various various religions, heritage, Black women, Asian women, Middle Eastern women, and many others with distinct cultural, religious, linguistic, and healthcare needs. A Black women's experience in the US might differ greatly from that of an Asian woman, yet they are often grouped together in datasets and discussions. So I think we have to be more specific when it comes to developing AI algorithms. The lack of specificity leads to invisibility and misrepresentation. It's not the AI that causes these issues, it's how we frame and input the data. And to build equitable healthcare systems, we need to be far more precise in how we describe our identity, experience, and needs. For example, if I were to touch on, the continental Europe, people over there are often classified based on ancestry and ethnicity. And I think it's easier to distinguish between someone, because they're classified by their ethnicities, it's easier to break down the data. For example, someone, with Norwegian roots, it will have different cultural practices compared to that of someone from Eastern Europe. So this approach leads to more nuanced and reflective data, and data that can better inform healthcare decisions and AI design. So in the end, AI is assisting us and it is a tool. And AI as a tool provides us with the output. How we choose to use that data is up to the physicians, professionals, and academic scholars who are collaborating. I'm hopeful about the investment coming into AI, and with the right algorithms, I'm hopeful that we will be able to revolutionize women's health and healthcare overall, given that we work together.
Amazing. Thank you so much, Afifa. I know that there's a fair few people here who probably have a lot of lived experience around the healthcare systems and technology. So something that I would love to get everybody who's on this wonderful call with us, everyone's perspective on is around trust and how we build public trust with these new tech tools that could help or hinder us depending on all of the things that we've talked about. So I'd love to get both of your thoughts, as well as everybody who's here with us in the Zooms via the chat. Feel free to chime in, put your hand up, whatever feels comfortable. What needs to happen for public trust to grow in AI? And that's a big question. I'm going to open up a can of worms with this one, but what needs to shift? Because a lot of what we're talking about is like disrupting the system. Systems change because a lot of what's evolving at such a fast pace with AI is obviously bringing these inherent system biases and ways of doing things along with it. And so how can we disrupt that? How can we build this trust with folks who maybe are not as aware of tech or are scared by it? So I'd love to know what your reflections are on that, as well as everybody here. I'm sure folks have opinions, so I'd love to hear what people think. And go with you, Lesley-Anne.
just currency and somewhat lacking across every aspect of society at the moment, in experts, in institutions, in governments. Yeah, it's a tough one. And, a lot of it is linked to privacy. AI is going to be, is, and it will increasingly be handling really sensitive data. And, there's already questions with the current kind of social media platforms: who owns that data? How is that data used and sold? Are we products, or is the data being used for our benefit? I mean, I think in many cases, clearly not being used for our benefit right now. So I think going alongside with trust, there's also that, what are the unintended consequences of AI? When the iPhone came out in 2007, which seems like 100 years ago now, nobody expected that there could potentially be this correlation between the iPhone and the mental health of young people around the world. So I think with AI, it's issues around trust, it's issues around privacy: who owns the data, who sells the data. And there are really interesting conversations going on right now around sovereignty of data, and actually individuals owning their own data, and being able to choose who has access to that. And so I think these bigger kind of conceptual issues, which are not the sort of sexy kind of new technology gizmos, but they have to be thought about and baked into it. So that whole part of what we've really touched on around the ethical and responsible development and use of AI. And so I think that sort of, how do we ensure digital bodily autonomy, when so many companies, and including health insurance companies, pharmaceutical companies, and others, will have access to that data? So I think, to your question, Claire, trust, I think it's a really, really tough one. And I think trust comes through human connection, and it comes from knowing that people are held accountable if there are mistakes made. And it's understanding how process and accountability, who manages that, and who pays if things go wrong. So I think there's a whole, like you said, it's a huge question. There could be a whole university course on how do you build trust around AI, and I'm sure they exist already. But yeah, it's a tough one. And I'd love to hear from anyone who's on the webinar if you've got thoughts about that as well.
And like you said, it feeds into so many global conversations that are being had at the moment around trust in systems and trust in government. So it's not a standalone issue, but I think it does feed into these other conversations. And thank you, Tony, for sharing your reflections in the chat. I appreciate that. Afifa, I'm curious to know what you think about how we can better build public trust, and how we can better, maybe as practitioners in this space, like model that, or look at how to bring people into these conversations.
Thank you, Claire. I think I agree 100% with Lesley-Anne that it is a tough question, and we're not quite there yet, but stepping stone. We have to make small, we have to take small steps. I think it begins first and foremost with the engagement and collaborations, interacting. If I were interacting with a client and I had AI in my toe, or if I were a doctor interacting with patients, I would begin with clarifying their questions and concerns. And in the process, you're also seeking consent and being transparent. So it's about changing the outcome together. Any, novel technology will have both critics and supporters. But if we're engaging with our patients, our clients, and having a discussion, sitting down, or even just, as something as simple as having a discussion over a cup of tea or coffee, that might, get the ball rolling. So why not just, engage more with the people that we serve? I think that's one way to start out this process of fostering public trust. Also, I think some of the concerns that Lesley-Anne mentioned about privacy, the data privacy concerns. If the hospitals and the physicians are asking for patients' consent, that would really help with the patients trusting the system better. And I think that's one of the ways we could, besides engaging with the patients, one of the ways we could start the process.
I think it's such cross-cutting a cross-cutting topic, right? And so I'd love to get some reflections from people here with us today. I know Shai, you put a couple of things in the chat. Penny, you had some comments about you're not surprised that there's distrust, 100%. So if either of you would like to share some either reflections or questions, not to pick on you, but it just popped up there for me, Penny. I can see your face, so I'm going to ask if you have any questions there. I think you're on mute though. I can't hear you. Can you just, oh, there we
That's
go.
it. Yeah, you should hear me now.
Yeah.
I was going, what I was going to say was because I've done a lot of volunteer activity, so community activity with women's groups. I've done things like pregnancy testing, been involved with things like rape crisis and all those sorts of things. And the reason why we were doing that a few years ago was that the services either weren't available or we wanted to have services by women for women. But it seems to me that it's, the things that were happening then are still happening now, that services are designed mainly by men, and certainly the tech designers seem to be. So that's why I'm saying, well, I'm a bit distrustful really, and cynical and skeptical really. I think and also my other thing that goes through my mind is how practical is it that I think that transparency is what we need, that anybody who's a patient and part of their care is somehow delivered by AI, they need to know that, and they need to consent. But in what's happening in the UK is that you have very short consultation periods with a GP or some other health service professional. How will it actually work? And my final point is that also in the UK, there's been, because I'm an older woman, there's been examples of where there are virtual pets and like robot dogs and things going into care homes that like replicate for a resident in a retirement home some sort of contact in those cases with pets, which is deemed to be very good for people. But I've never seen a resident of a care home, a residential home, stand up and say why they like these virtual pets. So we need to hear from the women who are experiencing the AI why they like it. I think that if it was a great thing, we would be hearing about why people liked it. When I was pregnancy testing, we got really good feedback about why it was great. You could get a pregnancy test there and then. But as I say, I don't hear people saying why they like virtual pets. So I've got loads of sort of experiences, but I want to listen to what everyone else has got to say.
Thank you so much, Penny, for sharing your personal experience and observations.
Yeah.
I appreciate that. Lesley-Anne and Afifa, if you have anything that you'd like to add on that, please do, or any kind of thoughts. I can also ask Shai to come off camera or come off mute and ask any questions that you may have.
I think, Penny, that was just so thoughtful and really reflects my experiences working in many countries in sub-Saharan Africa. Is if you just design for people rather than with people and understand what they need, then you are not designing something that's in the end going to serve them well. And that does go to trust and that idea of transparency. I had an experience a few years ago where I was in intensive care for over 6 weeks, in hospital for over 8 weeks, and I know a lot of the tests and diagnosis and the sort of treatment regimes were probably managed by AI systems. I wasn't really well enough to ask about that, but what really meant everything to me was the human touch and the kindness that I received from the nurses that worked with me and the doctors and the students that worked with me. And so, there is some comfort perhaps in knowing that the AI is doing a sort of 5% better job than the student doctor, but actually having that person sitting next to me and asking me how I am, that's also part of getting better. And so I think that kind of trust and transparency is also tied up with that human connection. Now, look, it might be a generational thing. It might be, when Amara, who's born today, in 25, 40, 50 years, she won't care at all because she will be totally in a digital AI world. And it will be like, oh my God, all these messy humans driving cars. Who would let a human drive a car? Who would let a human be a doctor? Because they just make mistakes and they're tired and whatever. And so maybe it's a generational thing, but if you look back over hundreds of years, trust is something that has been an issue from day one, year dot. And I can't see that going away. And so I think it comes back to this is not just a health moment or inflection point, this is a design moment. And it's about designing with, and that means, to Afifa's point earlier, it's about leadership. It's about, you need women in policy, you need women in leadership, you need women regulators, you need women designers, but you need to start, as Afifa also said, with the patient. And that's kind of what you were saying as well, Penny. Like, you heard from those women why those pregnancy tests were of value. And I hear the same thing from young people who are self-testing for HIV because they don't want to go into a clinic necessarily and be seen. They want to be able to do it in the privacy of their own home, and AI and a digital tool can help them to do that. So it is really that understanding, who is going to be using these tools and why.
Thank you so much. Shai, I'd love to know a little bit more about some of your work if you're comfortable sharing. I know you popped some stuff in the chat there, so I'd love to know a little bit more.
Of course. Well, it's so nice to see you again, Claire. And thank you so much, Leslie and Afa as well, for your presentations today. I've just learned so much about kind of the role of AI in women's health, just given that that's not a space that I'm as familiar with. My background is in data science and machine learning. That's where I got my master's from. That's the work I've done for several years in the government and private sector. And I'm now trying to come back into the space. And you're right, it is heavily male dominated. I think every class I've taken, I'm like one of three women, and it's been that way for several years. But what I've learned recently and what I'm trying to do now with our startup, which is called CareLumi, is that we're trying to help professional caregivers, which are predominantly women, get back their time from the tedious administrative burden of paperwork. So it's a little bit of a different angle to the health challenges that you all have been discussing, but thinking about that childcare worker, that pediatric therapist, that's the market we're in now, to the at-home CNA who supports the elderly, as well as those who work in a hospice or palliative care. They're spending about 15 to 20 hours just on paperwork, and that's after delivering the care to their patients. And so AI does have a very unique ability to help streamline that type of workflows. Now, I don't think AI should be used to give health recommendations per se. And I feel like a lot of the tech bros that are always in the spaces that I'm in is like, yeah, we're going to have AI doctors and AI nurses. But I don't think that's possible, right? Because every individual, regardless of their condition, has like a very unique path to treatment. And if we allow AI to try to standardize that path, we might end up losing out on an opportunity for someone. And I think, Leslie, you mentioned earlier just about like the weight difference from the medication. The AI won't necessarily know that right away without having that training data, and it has to be able to learn and correct that. So I think that's a big part of trust is, do I trust a doctor who has 20, 30 years of experience, who have seen different patients of different ethnicities, backgrounds, ages, or do I trust an AI that has access to a limited data set that might be growing, right? But we also don't know who provided the data. And so I think for like me as a person, that is my issue with trust. And then, yes, happy to share as well about just what health insurance providers are saying. They're not one of our customers, but we do help our customers produce claims to those providers. And they're kind of feeling the same way, where they feel like there's a gap in the provider and the payer when it comes to trust. Like, do I really trust that the provider, as the doctor, is giving the right prescription for this patient if they're just relying on AI? And a lot of times that comes with things like chronic illnesses. So if you have cancer treatment, and your provider needs a prior authorization, they might say, oh, I need you to do XYZ step. The payer obviously is like, wait a minute, we don't want to spend all that money. And do I trust the AI as the recommender for that? So when it comes to care, delivering care, I don't think AI is the best. When it comes to helping speed up the efficiency of care, when it comes to paperwork, claims, I think AI can do a great job.
Thanks so much, Shai. I'm curious to know what Afifa and Lesley-Anne have to say about some of the work that Shai is doing, or the thoughts and reflections. I think super valid points around that care process and how tech can help or hinder certain aspects of that.
And one of the things I'm curious about, you referred to kind of professional caregivers and how AI can help streamline those kind of administrative and other workflow processes. But given in the home, women are typically responsible for their and their family's health. And I'm wondering how much these AI tools will now become the responsibility of the woman in the home to manage how the data is being used. And anyway, it's just a sort of a side thought. But I think that issue around trust and in the data and trust in who's using the data and how it's being used for making decisions sounds like something that you're working on, which is really cool.
So building on Lesley-Anne's points, I'm gonna briefly talk about AI Scribe, a tool that's being used by some of the doctors these days. I think the issue here is that we do not trust our physicians. We do not trust the healthcare practices. It's not the AI. We don't trust them because we are unsure whether they're actually reviewing the summary, whatever AI is giving them, the output, the data, the model. We are not sure if they're reviewing them, they're correcting them, and they're giving that human touch. To Leslie's points, the human touch. So if it's, goes without saying, AI can contain hallucinations, misunderstandings, mishearing. So as always, the physician must review them before entering the data into the patient's file. AI isn't us, and it can't really read how you articulate your thoughts in your head. So as always, best to humanize the patient summary. Even if it's giving you a brief summary, you have to humanize it. You can't just put it up as, oh, it's just a summary and that's all. But it can miss out on information. It doesn't have that human touch. How would the AI know how exactly you were looking at that patient who just visited your chambers? AI doesn't quite know that. AI only knows what you're feeding them. Mm-hmm. So I think we have to approach it in a more human way. If we want to make progress on around the transparency and trust.
Just go radical tech for a moment, because I'd noted down, and we haven't got time, but some of the really cool AI stuff that's happening around synthetic data, around digital twins, around brain mapping, around genomics. I mean, there is some really, really cool stuff. There's no question. I think everything, that Afifa and I have alluded to today will continue to be really important around the, invisible women, the missing data, the bias in the data, and so on. But, there's some really, really cool stuff happening. And so going back to Amara, who was born today, she's going to have access to stuff that I could only dream about, really. And I think, Shaya, going to your point about AI or doctor, I mean, it's not replacing the doctors with AI. But that said, there's over 1 billion people every year who have zero access to a health worker. So it's not like, is it a doctor or is it AI? There is no doctor. There is no even community health worker sometimes. And so having access on their phone to apps that are able to provide them with information and to do some self-diagnosis is like, it's better than nothing in many cases. So, I'm kind of super enthusiastic and excited about what AI can do. And I engage with it myself on a daily basis in all kinds of my work. And I just think it holds extraordinary promise for women's health. But I just think, we just need to ensure it reflects women's realities, that we get those women into positions of design, decision making, and regulatory framework support, so that the AI will work for us as women. And let's face it, we're half the population on the planet, and right now, our health is being ignored to a large degree across many countries in this world. And AI has the potential, I think, to address some of those inequities and gaps that we see existing around us.
Thank you so much for sharing. We're almost finished our time together, and I've really appreciated how everybody has shown up and shared their thoughts, comments, feedback, reflections. Lesley-Anne and Afifa, any last minute things that you would like to share with our lovely attendees? Feel free to do so in the chat. If there's any key takeaways that you want folks to take, like your LinkedIn or an email or ways to connect, whatever that may be, feel free to pop that in the chat. But I also just wanted to let folks know that if you are a fellow with the RSA, then there is a responsible AI network that has a lot of conversations similar to what we're talking about today, and maybe not like women's healthcare specifically. This feels like a new event that we have done, which we're really excited about, but covering all of the responsibilities, ethics, conversations that come out of working in and with AI. So please do let us know if we can share any more information about that, or if you're interested in connecting with our responsible AI network leads, be happy to put you in touch with folks. And if you have any conversations at all, no question is a silly question. Please feel free to send me or my colleague Tony an email. We'll be sending a follow-up note to you all probably later on today or first thing tomorrow morning with a recording of today's conversation, various different links that were shared, and ways to kind of stay in touch. So don't worry if you didn't capture everything during our chat today. It's a lot to digest. And it was just really wonderful getting to meet you all and hear about your experiences. And thank you so much for your time, for your energy, and your experience. We really appreciate you. Have a lovely rest of your afternoon, day, evening, wherever you are in the world. And hopefully our paths cross again in the near future. So thank you so much, everybody.